Hey guys, this is Dr. Mike D, and today I'm gonna do another reaction video. So I'm gonna react to another Comedone extraction videos because there's like thousands of them out there, and I've seen a lot of gruesome Comedone extraction videos which are improperly done. I'll be reacting to a video from YouTube, and it's called Large Blackheads Removal Best Pimple Popping Videos. It's from a content creator called or known as Poppy. Alright. So it has this very soothing. Alright. So just the video started off like where the technician started to just pop the pimples with her thumbs right there. Alright, so I think she's using a blade, a scalpel blade. So she's using a scalpel blade there to make an incision for the closed comedones. So closed comedones basically are like accumulation of sebum under the skin, but virtually the hair follicle does not have any opening, so that it creates this micro comedone, or this collection of dried sebum and debris under your skin. So she's opening that up with a gauge 11. I think it's a gauge 11 needle. Wow, she's just pinching, no? She's just pushing on the skin. So when you push on the skin, the pressure actually causes the comedone to come out. But this is not a very good technique because you can actually push more comedones, or some of the comedones, deeper into the hair follicle, and the patient can actually come back with a more inflamed acne, or you can actually trigger acne and scarring. So see how the fingers are leaving an indentation on the skin. So this will cause a lot of injury to the skin. So see, there's blood already coming out. So there's blood already coming out. There. So this patient has an oily type of skin. So his or her sebaceous glands are quite active. So I'm assuming that this patient is in his or her adolescent age. So during this time, the androgens are surging, and the hair follicles, especially the sebaceous glands, are very sensitive to circulating androgens in the body. So that kind of triggers the whole cascade of sebaceous gland activation and sebaceous secretion accumulating in the hair follicles, causing these comedones, or blackheads, or whiteheads that we refer to. So I'm not so sure if the gauge 11 needle will be a nice a gauge 11 needle is a very nice tool to make an incision or prick the surface of the skin, because you need very stable hands to use this blade, or else you can actually create a wider incision, and a wider incision means scarring. So you don't need that. You don't want patients to have scarring from the incision. So personally, I would just use a gauge 30, a very small gauge 30 or gauge 32 needle to nick the surface of the closed comedones. Yes. Wow. So this is painful, I think. So some comedones you would see will just this doesn't come off with a lot of effort, because these are comedones that are just lying beneath the skin, and they're just very superficial. So if you can just if the if you will just put a little pressure, it just comes off. But I'm not encouraging to do it by yourself, because you can actually hurt yourself. So I'm a dermatologist. I will like my patients to be safe at all times. It is better that you have a board certified dermatologist guide you in terms of these things. No? So there. I really don't suggest to do this technique, because there are better ways to do it, and there are better ways to accurately target the comedones. There are better tools that can be used to put pressure accurately around the comedones without affecting other areas with comedones, so that you don't push other comedones deeper into the skin. So she's now doing the chin area. So be careful with the chin area. If you're doing something like this, it's definitely gonna scar. So please don't touch your chin or your nose, because the chin and the nose are very infamous for hypertrophic scarring or keloid scarring. So generally, keloid scarring is very rare on the face, because the face heals very well, and keloid scarring, or scarring in general, is correlated with poor healing of a certain anatomical area. But since the face heals very well, the face is a very uncommon area for keloid formation. But if you have zits, blackheads, whiteheads, acne over the chin and on the nose, please do not pop them, because if those things scar on those areas, they are very, very difficult to treat. So I find the scars in the chin and the nose, the hypertrophic ones, the papular hypertrophic ones, very, very difficult to treat. So please ask your board certified dermatologist how to approach your acne. All right. So there. I hope you enjoyed that video, and I hope you found this particular episode very informative. And I look forward to other videos, or reacting to other comedone extraction videos. If you have any suggestions, just let us know. Drop me a quick message in Instagram. We would love to hear suggestions from you. What are the things that interest you in terms of skincare? Also, if you have any comments, if you have any reactions to this video, please drop us a comment below. And yeah, so there. I hope you guys are staying safe, your family are safe, and I will see you in the online clinic. All right, guys, bye.